If you have found your way to this chapter, chances are that you have enrolled in an introductory course to help you decide if athletic training is the right choice for you. It is imperative that students understand their desired course of study, specifically the rigor, clinical demands, and professional opportunities that await them upon graduation. Chapter 3 will cover the educational requirements for athletic training. To sit for the BOC exam to become a certified athletic trainer, you must graduate from an athletic training professional program that is accredited by the Commission on Accreditation of Athletic Training Education, or the CAATE. The mission of the CAATE is to provide comprehensive accreditation services to institutions that offer athletic training degree programs and verify that all CAATE accredited programs meet the acceptable educational standards for professional athletic training education. Universities and colleges that offer athletic training programs must be dedicated to supporting the educational program, put forth the appropriate faculty and resources, and undergo an extensive self-evaluation followed by on-site review in order to be an accredited program. Athletic training programs utilize a combination of formal classroom instruction and clinical experience to prepare athletic trainers to apply to a wide variety of specific healthcare skills and knowledge within each domain that comprises athletic training. A listing of accredited athletic training professional programs can be found online at the CAATE website. The link to this site is provided on this slide. During the educational transition, students can still choose from two kinds of professional programs, those granting baccalaureate degrees and those that award master's degrees. However, many programs are already making the required transition to an MS degree. Please visit the CAATE website to see the current list of programs and their degree offerings. Professional athletic training master's programs are appropriate for prospective students who already hold a degree in a related field and would like to pursue athletic training without getting a second undergraduate degree. Students in this situation may be able to finish a program in 2 or 3 years rather than the typical 4-year degree. Some students will select their college or university choice based on the athletic training program. Some will find the program after they are on campus, and some may seek out a program as a transfer from a 2-year college or other institution. In any case, the best place to start is both the program and university websites. It is important to find the program and institution that best fits you. Interested students should speak to as many program personnel as possible, making contact with the program director, as well as other athletic training faculty, clinical preceptors, and current students in the program to get a feel for the program from different perspectives. The NATA website maintains an information section for prospective students that contains a wealth of information. On page 47 in your textbook, there is a list of the different roles and definitions that can comprise an athletic training personnel. Additionally, page 48 provides the importance of observing an athletic trainer to learn the ins and outs of the job and to see if this profession is the best fit for you. While each program is unique, the accreditation process is in place to ensure that all programs meet essential standards for the preparation of athletic training students. Students should be aware that most athletic training programs are competitive and require an admissions process. It is paramount that prospective students gather appropriate data regarding the admissions process for the programs they are considering to be sure that they are on track to be considered for application into a professional program. Once a student has been admitted to the professional phase of an athletic training program, there are 8 specific content areas that contain competencies that are a collection of knowledge, skills, and clinical ability areas which must be mastered in order for a student to be able to be successful in passing the Board of Certification exam. The 8 content areas as outlined in the NATA educational competencies are as follows: evidence-based practice, prevention and health promotion, clinical examination and diagnosis, acute care of injury and illness, therapeutic interventions, psychosocial strategies and referral, healthcare administration, and professional development and responsibility. Details about each area can be found at the website at the bottom of this slide. The preceding professional content areas are required for all athletic training programs. In addition, programs can require a range of prerequisite or complementary courses that go above and beyond the listed requirements. While programs have the freedom to determine how these topics are presented and what they will be named, students can be assured that if a program is CAATE accredited, these content areas will be covered. Sequencing of courses ensures that students obtain the information in a logical fashion and that the necessary foundation is in place prior to learning specific information in the athletic training core program. It is important that courses be sequenced so that athletic training students can acquire specific clinical skills prior to putting the skills into practice. A greater discussion of clinical requirements follows later in this chapter. Examples of courses that may serve as prerequisite courses or provide complementary content at William Patterson University and other athletic training programs include, but are not limited to, the following: physiology of exercise, sports emergency care, human anatomy and physiology, biomechanics, statistics and research design, strength training and reconditioning, chemistry, physics, and sports psychology. The CATE requires that the athletic training competencies be instructed and evaluated in each accredited professional athletic training program. The educational competencies serve as a companion document to the CATE accreditation standards. The Professional Education Council of the NATA was charged with creating the 5th edition of the athletic training competencies. The athletic training educational competencies are designed to assist in identifying the knowledge and skills to be mastered as part of a professional program. Athletic training programs use the competencies for curriculum development and the education of students enrolled in their program. Competencies are outlined within each of the previously discussed content areas and the practice domains that make up the role of the certified athletic trainer. Since the publication of this textbook, there have been changes to the competencies, such as there being no cognitive and psychomotor domains. This happens from time to time as athletic training education is an ever-evolving entity. Educational content and specific competencies will be met through traditional classes, labs, and clinical opportunities. It is the clinical opportunities that help set athletic training programs apart from other endeavors. Students in athletic training professional programs must demonstrate clinical proficiencies. The Clinical Integration Proficiencies, or CIPs, represent the synthesis and integration of knowledge, skills, and clinical decision-making into actual client-patient care. In addition to competencies and clinical proficiencies, the athletic training educational competencies include foundational behaviors of professional practice. These represent basic behaviors that permeate every aspect of professional practice. Programs should incorporate them into instruction across the curriculum. Clinical experience is a vital element to the educational preparation of the athletic trainer. Athletic training has long provided hands-on opportunities for students to clinical practice. These clinical opportunities link the theory of the classroom to the practice in the clinical environment. Clinical education is based on the student's ability to demonstrate mastery of clinical proficiencies. The required clinical components of an athletic training professional program will allow students the opportunity to see a variety of settings, interact with an array of sports medicine professionals, and develop needed athletic training skills. However, clinical proficiency extends beyond the simple mastery of skills. It requires an integration of cognitive, psychomotor, and affective components to form an appropriate clinical outcome. The clinical education experience provides students with technical skills as well as the opportunity to see how athletic trainers utilize interpersonal skills, work with a diverse patient population, and collaborate with other professionals. Through a structured and varied clinical program, students can learn the art and the science of athletic training. The CATE standards for the accreditation of professional athletic training programs outlines the requirements for a college or university to offer a professional program in athletic training. The guidelines for standards can be found at the website on this slide. These guidelines provide the link from the classroom to the authentic practice of athletic training. Programs must provide for students to gain clinical experiences with a variety of different populations, including both genders, varying levels of risk, protective equipment, and medical experiences. These experiences must address the continuum of care that would prepare a student to function in a variety of settings and meet the domains of practice delineated for an athletic trainer. Many CATE standards are designated to protect the student and to ensure that clinical education is truly educational in nature. Students will not replace professional staff athletic trainers or medical personnel, and the athletic training program must include provision for supervised clinical education with a preceptor. A preceptor must directly supervise students during the delivery of athletic training services. The preceptor must be physically present and have the ability to intervene on behalf of the athletic training student and the patient. For more detail about how clinical education is progressive and what the supervision requirements are, please see page 56 in your textbook. To protect both the athletic training student and the preceptor, the student's clinical experience must be carefully monitored. The essence of experiential learning is doing things. The only way to really learn the skills required to be an athletic trainer is by doing. Clinical experiences will provide the students with the chance to perform the skill learned in an academic setting. Students also learn day-to-day practice of athletic training that cannot be duplicated in an academic exercise. Students must also be aware that the expectations for clinical settings will vary. The needs of the patient come first. Creative instructors and appropriate supervision will allow students to meet their learning goals, but there will be a time when getting the job done in the interest of the patient is a priority. Supervision is key to clinical education. While experiences will vary from program to program, the presence of a supervisor is required for specific learning activities that involve patients. There can be other related experiences in your program that may allow for differing levels of supervisory interaction. Students should always make sure they communicate with their director and clinical supervisor to make sure that they are adhering to the requirements of the program. Ideally, clinical education serves to link athletic training theory to practice. However, this is not always an easy connection. This link is sometimes complicated by the fact that students may see practices in this clinical setting that differ from current interpretations of research presented in the classroom environment. The classroom and clinical environments must not be viewed as program components that are independent from one another. The more students can connect them as learning environments that complement one another, they can maximize their learning and will be better prepared to recognize and learn from the occasional differences that may arise.